Can you name one of the largest organs in the body? I'm Catherine. Welcome to the Inspired Vitality Show. The answer is the liver. The liver filters harmful substances from the blood, produces bile that helps in the digestion of fats, and stores sugar that the body uses for energy. I'm taking the lead of the American Liver Foundation to include education about liver disease during Liver Cancer Awareness Month. Stick with me and you'll understand why it's important to learn about liver disease as it relates to liver cancer. And then I'm going to give you some do's and don'ts for a healthy liver. There are more than 100 different liver diseases, and the most common cause of liver disease include viruses such as hepatitis B and hepatitis C, excessive alcohol use, and non-alcoholic fatty liver disease. Simply put, liver disease is any condition that damages the liver and prevents it from functioning well. Most liver diseases result in similar damage to the liver, and for many, the progression of the liver disease looks the same regardless of that underlying disease. Many people with liver disease do not look or feel sick, but damage is still happening internally. Over time, scar tissue builds within the liver and can lead to cirrhosis. Cirrhosis is a late-stage liver disease in which healthy liver tissue is replaced with scar tissue and the liver is permanently damaged. This can lead to serious complications as scar tissue keeps your liver from working properly. The scar tissue blocks the flow of blood through the liver and slows the liver's ability to process nutrients and hormones, drugs, and natural toxins. Scientists estimate that cirrhosis of the liver affects about 1 in 400 adults in the United States. Cirrhosis of the liver isn't cancer. Any cause of liver disease can lead to cirrhosis, which increases your risk of liver cancer. If you have cirrhosis, you have an increased risk of liver cancer. If you have hepatitis B or hepatitis C, you have an increased risk of liver cancer because these diseases often lead to cirrhosis. Even if you have hepatitis B or fatty liver disease without cirrhosis, you are at an increased risk of liver cancer. Most people who have liver cancer have cirrhosis. So, liver disease puts you at an increased risk for liver cancer, regardless if that disease led to cirrhosis. You can greatly reduce your risk for liver cancer by preventing or diagnosing and treating these diseases early. As I said, having hepatitis B, hepatitis C, or cirrhosis are significant risk factors for adult primary liver cancer. Liver cancer is more common in men than women. In its early stages, liver cancer may not have symptoms that can be seen or felt. However, as the cancer grows larger, people may notice some common symptoms. It's also important to remember that these symptoms could be caused by other health conditions. If you have any of these symptoms, though, talk with your doctor. These symptoms can include discomfort or a hard lump in the upper abdomen on the right side just below the rib cage, a swollen abdomen, pain near the right shoulder blade or in the back, jaundice, easy bruising or bleeding, unusual tiredness, nausea and vomiting, loss of appetite, and weight loss for no known reason. There are things that you should and shouldn't do to prevent liver disease and lower your risk of liver cancer. Some of the things that you should not do if you want a healthy liver include the abuse of alcohol, eating raw seafood, especially oysters and clams, because these foods can contain a bacteria that can cause serious illness. And you should not be smoking. The things that you can do for a healthy liver include maintaining a healthy weight, because excess body fat can damage your liver. To do this, you can exercise regularly, Eat a healthy, well-balanced, low-fat diet, and cut back on the amount of salt in your diet using seasonings to flavor your foods. Other things you can do for a healthy liver include avoiding high-risk behaviors that lead to infection with hepatitis B or C, such as sharing needles for illegal drug use or having unprotected sex. You can get vaccinated against hepatitis B. If you already have hepatitis, ask your provider if drug treatment is appropriate for you. You can get tested for hepatitis C and get treated if you have it. You can avoid over-the-counter anti-inflammatory drugs if possible, such as ibuprofen and high doses of acetaminophen, which can cause or worsen liver function. And be sure to see your healthcare provider regularly for checkups following medical recommendations to control obesity, diabetes, hypertension, cholesterol, and triglycerides. Let me know in the comments if this video has taught you how to treat the largest organ in your body well so that you can prevent liver disease and lower your risk of liver cancer. For additional information, I'm going to link to some great resources in the video description. See you soon.